Modi, ENT and head and neck surgeon. Critically, it is through the nose that black fungus enters the body system. Now, as suggested by Dr. Subramaniam, there is the main reason is prolonged unhygienic oxygen delivery in a sense to patients. Possibly also some are suggesting with indiscriminate use of steroids. What's your sense? Why has black fungus entered? And can you give our viewers a sense of what are the symptoms to look out for?
So, like Dr. Subramaniam has said, it's not a new disease. And it is always a combination of factors which leads the patients to develop the symptoms. Now, studies have shown a lot of healthy individuals may harbor fungus in their nostrils, but the fungus starts invading the system only after the immunity drops. So it's a combination of, high dose of steroids, high blood sugars, especially once the patient is discharged from the hospital, where there is poor follow-up. Initial symptoms may be many minor. It can be nose block, it can be watering of the nose, it can be a facial pain, a dental pain, which the patient may ignore. Thus, we need to keep our antennas up. We need to keep a very high degree of suspicion when we are seeing patients who are post-COVID, especially in the first 60 days, is what we need to be on a high alert, especially if the patient has received prolonged oxygen use, high dose of steroids or ventilator.
But would you say, Dr. Modi, that it is linked, therefore, to prolonged unhygienic oxygen delivery more than possible indiscriminate use of steroids, or it's a combination of both?
So we are seeing this also in individuals who didn't receive a lot of oxygen, right? But unfortunately received steroids at home, unfortunately received very large doses of steroids. So it's multifactorial. I'm sure there is a part to be played by the oxygen too.
Okay.
But the high dose of steroids is something I think which also needs to be looked upon.
And you said a symptom was a nose block. Am I correct? An initial possible symptom?
It could be very non-specific. You know, you will have a patient coming with a non-specific cold, some very low-grade pain. The patients would have had the symptoms for a few days, and then they would come. And it's not something, that we don't see like 20 times a day already. But in post-COVID patients is something that we need to be very alert because this could be early signs.
Okay.